the present scenario, we are seeing a lot of heart failure patients whose numbers are rising very rapidly, especially amongst the younger population.
People don't understand the symptoms basically, which could be related to any kind of heart condition. That awareness, lack of awareness basically, I would say, is one of the major reasons that very young people, very talented young people, that we are ending up losing.
If we look at the heart, the process starts with something called as atherosclerosis. That's the formation of blockages, which starts at least 10 years before the actual symptoms or an clinical event happens.
Good evening, doctor.
Good evening.
Welcome to Explore. I'd like to introduce Dr. Amit Sinkar, who's a preventive cardiologist. He prefers himself calling as a preventive cardiologist. He believes in prevention a lot. He has done his MBBS, DNB medicine and DNB cardiology from Pune. Welcome, doctor. Thank you very much for coming here today. So I'd like to start by asking you today, what are the common heart diseases and conditions that you come across when you're seeing your patients in your daily practice?
In the present scenario, we are seeing a lot of heart failure patients whose numbers are rising very rapidly, especially amongst the younger population. We are also seeing a lot of heart attacks and coronary artery diseases, especially in the working population, who are at the most risk to lose their working areas because of heart-related diseases. And as the incidence of heart failure is increasing, so is the incidence of arrhythmias or heartbeat irregularities, which are associated with both coronary artery disease and heart failure. And to top of it, the precipitating or the risk factors related to these diseases like the diabetes, hypertension, cholesterol issues, all these risk factors are also simultaneously has been increasing because of the extremely stressful lifestyle that the present population is going through.
Very rightly said. One of the major reason also is that people don't understand the symptoms basically, which could be related to any kind of heart condition. That awareness, lack of awareness basically, I would say, is one of the major reasons that so many cardiac arrests are happening, that we are seeing that very young people, very talented young people, that we are ending up losing. You have
absolutely agree with you, whatever you have said. Unfortunately, people feel that during their day-to-day activities, if they are not getting any symptoms, that means they are completely healthy. But there are many subclinical factors which are going on in the body, which unless you actually test for these factors, people won't understand the possibility of subclinical diseases.
Correct.
Especially if we look at the heart, the process starts with something called as atherosclerosis. That's the formation of blockages, which starts at least 10 years before the actual symptoms or a clinical event happens.
10 years before?
Yes.
Wow.
And this atherosclerosis process is basically what I would say, it's a long-standing process and which happens because of multiple risk factors, including stress, including lack of physical activity, including bad dietary habits, including smoking, tobacco consumption, and this bad lifestyle ultimately causes something called as endothelial dysfunction. That's the bad lining of the blood vessels. That eventually leads to a process of blockage formation, and at one point of time, over a period of many years, these blockages keep on increasing, narrowing the lumen of the blood vessels, causing progressively decrease in blood flow to the heart. And whenever these blockages rupture, that leads to an acute heart attack. So unfortunately, in today's world, people are getting aware once they suffer from a heart attack. But if we can create awareness about the testing facilities which are available to predict these risk factors and its implications in the long run, then probably we can halt the disease at a much earlier date.
That's where prevention basically comes in, and understanding these symptoms basically, and then importance of lifestyle, living a good life basically with a balanced life also comes into play a lot. Very rightly said, sir. Absolutely. What do you think is the role of inactivity and high stress basically that younger population or even to large extent elder population also is exposed to, wherein the inactivity in particular resulting in long run reason for any fatal events basically that ultimately encounter?
Yes, actually, lack of physical activity is one of the important or amongst the important risk factors which are independently predictive of heart attacks in future, in fact. So that's why it is highly recommended that there has to be moderate level of physical activity for each and everyone. Now, unfortunately, in today's world, everyone is so busy in their work that they hardly find any time to give to their health or do any kind of physical activity. So nowadays it is recommended that even at workplaces, the workplaces should be designed in such a way that they can provide some basic facilities wherein some kind of physical activity can be done, especially in regards to endurance training as well as physical activities. And educational policies towards the employees regarding health has to be implemented so that the employees can have physical activity even during their working hours, so that the excuse of not having time would never be given.
Absolutely. With in today's time, traveling has become so cumbersome and so with so much of traffic. If workplaces are able to provide places for workouts and exercise, that can become a big boon for people working in such places. Also, you mentioned, I noticed that you mentioned importance of moderate activity.
Yes.
Not high intensity, but you mentioned word in particular, moderate.
Yes.
Would you like to emphasize something on that side?
Anything is excess is poison for everything, and that is applicable to exercise also.
Yes.
So if someone wants to start any physical activity, it has to be very gradual in onset. Initially it has to be started under the guidance of a proper person, because one needs to understand their own physical capacity so as to start the exercise levels. And from that particular base point, they need to gradually increase and reach up to a moderate intensity, which has been very clearly defined as about 150 minutes in a week of moderate intensity exercise. They shouldn't be exceeding to a strenuous level, because very vigorous kind of exercise are likely to cause sympathetic hyperactivity, which can cause heartbeat irregularities, and most of the times it is such kind of untrained heavy exertion that leads to sudden cardiac arrest, especially in those people we see who are running marathon or who are doing cycling for a long time. And these people, if they are not properly trained or if they have not passed through a gradual transition to that level, then we quite often see sudden cardiac arrest in such people. So it's always recommended that moderation is the key. Anything which is untrained should never go to high intensity training.
You mentioned about sudden cardiac arrest. There's a big confusion in minds of people as well. What is the difference between a cardiac arrest and a heart attack?
Yes.
Very few people understand the distinction. Would you like to highlight and
very good question, and most of the people are still not aware about the difference. Sudden cardiac arrest is basically sudden stoppage of the heart's electrical activity. Yeah. So whatever heartbeat we can feel or we can hear, that heartbeat completely stops. That's what we call it as sudden cardiac arrest.
Correct.
So basically it's an electrical phenomena. The heartbeat is generated through an electrical system in the heart, and when that electrical system fails, there is sudden stoppage of the heartbeat, which is called as a sudden cardiac arrest. And it's a dire emergency, because within next few seconds, if the heartbeat is not restarted, there would be death or permanent damage to the brain. Whereas there could be multiple reasons for this sudden cardiac arrest, out of which heart attack could be one of the possible reasons. Heart attack basically is a plumbing issue of the heart. The heart needs its own nutrition through a blood supply, which is happening through coronary arteries. These are the blood vessels which supply blood and nutrition and oxygen to the heart. And whenever there are blockages that happen within this plumbing system of the heart, that leads to a heart attack. And sometimes because of the heart attack there is muscle damage along with damage to the electrical system of the heart.
Which further leads to...
Yes, so a major or a severe heart attack can also cause sudden cardiac arrest, but otherwise there could be non-heart attack reasons as well for causing sudden cardiac arrest.
Thank you so much for this clarity. I'm sure, people listening to this particular conversation will get to understand. And also, in case of sudden cardiac arrest, the remedy is that should be given is CPR.
Yes, yes.
That should be understood as well.
And within the first 30 seconds to 1 minute.
Yeah.
That's most important.
Which becomes very difficult in places where people are encountering such fatal events.
So I would in fact recommend many people or most of the people should get educated with the basic CPR techniques, so that in case of an emergency they should be able to deliver basic CPR at any outdoor location. That would definitely help the patient to at least reach the hospital for further survival.
I'd like to also ask in furtherance to this particular topic that we just discussed of sudden cardiac arrest. One of the major factors responsible for sudden cardiac arrest is arrhythmias.
Yes, absolutely.
Would you like to highlight basically how it leads to sudden cardiac arrest?
Arrhythmias is a very broad and generalized terminology. Not many people are aware of the word arrhythmias per se. In heart disease, whenever there is any heartbeat irregularity, which is which is away from the normal regular rhythm of the heart, that's what is called as arrhythmia. Now, it can be a bradyarrhythmia, that means lowering of the heartbeat, or it can be tachyarrhythmia, that is abnormally fast heartbeat. Not only that, it can be regular or irregular. Practically, there are 21 plus types of different arrhythmias. Some may be very benign and non-dangerous, but few of them can be life-threatening. So, amongst them, there are few specific arrhythmias called as ventricular tachycardia or ventricular fibrillation, wherein the lower chamber of the heart, that's the ventricle, beats at rates of up to 300 beats per minute. And such high rates, the heart is hardly able to pump any blood out of the heart into the body. And that's what leads to a cardiac standstill, wherein there is an electrical activity but no mechanical activity of the heart. That can itself lead to a sudden cardiac arrest. So it is very important that such kind of arrhythmias should be detected at an early sign, and the earlier we detect these arrhythmias, the better we can treat them in time, because once sudden cardiac arrest happens, then we have very small time left with us to recover for the heart. If we can detect these arrhythmias at a much earlier timing, then probably we'll have much better time so as to save the heart.
Absolutely.
So we need to have better technologies where we can detect these abnormal heart rhythms at a much earlier date and time.
As you mentioned technologies, I'd like to ask you, you have used CardiacSense in your practice.
Yes.
What has been your experience so far in terms of usage with your patients? Any experiences you would like to share?
Yes, it's a truly a medical revolution, I would say. We never had such a device which would monitor a patient's vital parameters so swiftly and without causing any discomfort to the patient. Most of the times, it's a common clinical practice that whenever the patients visit to our clinics, just because of anxiety, the heart rate and the blood pressure goes up. And that's what we call it as white coat effect. And to relieve this anxiety, we have been asking our patients to monitor their parameters at home. So even at home, whenever they are using such medical devices, still there is some amount of anxiety because they are knowing that they are checking some parameters.
Yeah.
Now, CardiacSense is such a watch which can be worn daily as a routine watch, and unknowingly it is checking the patient's vital parameters without even the patient knowing that they are actually checking the vital parameters. So that is the biggest advantage, that the component of anxiety is completely taken off.
Yeah.
Not only that, it is giving 24/7/365 readings, so on a continuous basis, without the patient having to take any effort to get hold or catch a medical device to assess these parameters. So it's a long long-term continuous process of monitoring the vital parameters, and sometimes it can also happen that the patient is getting symptomatic, but at that time if the patient is not having the medical device to detect the abnormality during the symptom, then the symptom wears off and we are not understanding what exactly must have happened during that period.
Correct.
So CardiacSense watch also gives us that flexibility that whenever, if at all the patient is having any kind of cardiac symptom, what is the ECG abnormality or the heart rate variability or the blood pressure variability that's happening in the patient, it can be picked up at that very particular moment during the symptoms.
Correct.
So that's the most important feature that I can see in the CardiacSense. On top of that, this information can be accessed by the medical practitioner across the world sitting anywhere. So the patient need not be seeing the doctor immediately. Wherever the patient is across the world, the doctor can immediately get notification on the abnormality which can be transmitted through this particular platform.
One aspect further I'd like to ask, and would like to request your feedback, the importance of trend monitoring.
Yes.
So when a patient is coming to you after a month or 2 months of gap, depending on the schedule basically that he is asked to visit, he's coming in getting a spot checks basically.
True, absolutely.
Do you think that a solution where a patient is wearing a medical watch like CardiacSense, he is being monitored and all his vitals and every aspect of his health, whether he is doing activity, what was his health, what was the heart rate, when he's sleeping, what is his resting heart rate, what kind of breathing that he is doing, how frequently, if he is experiencing any kind of apneas, if these kind of trends, or if he's had any kind of events basically which are significant or non-significant, everything getting recorded, and if he's coming to you for repeated visit, he's coming with a trend recorded to you. How do you see a difference in your service to this patient that can make when you are monitoring a patient's coming with this information available to you at a quick glance in easily designed reports versus a patient who's just coming with nothing or very limited information? Do you think your service and your treatment to the patients will be very different in both cases? Definitely,
100%. Because till today, what we used to rely on, as you rightly said, were only on the spot readings or the clinic or office visit readings.
Correct.
And these readings used to be around 3 months apart or 4 months apart, only during the follow-up visits of the patient.
Correct.
So we were not aware what the patient is going through on a regular basis over these past 3 or 4 months.
Correct.
So this particular technology is definitely a mirror to the physiology or the actual physiology of the patient,
yeah,
what he or she is going through over a period of 24 hours, and during various phases, it may be of work, it may be of emotional changes within the body, as well as any kind of stress, physical, during exercise, during sleep. So all the circadian rhythms can be very well picked up on this device, not only during the 24 hours, but over a greater span. We need to know how the body is going through.
Correct.
Especially with the vital parameters. The blood pressure fluctuations may be there during most of the times, which probably we are in a better position to pick up in this trend. The heart rate variability is an important feature because that tells us about how high or how low and how frequent these deviations are happening from a baseline, because these fluctuations are also now proven to be an independent risk factor for future cardiac events. So that's why these trends are very important in adjusting the treatments of these patients, not only for changing the treatments, but also understanding the effect of these treatments on the body.
Exactly. Very rightly said, the way continuous glucose monitoring is changing the line of treatment for patients.
True.
Do you think that CardiacSense is poised to bring about an enormous change in the way the line of treatments are designed and decided for patients?
Yes, absolutely. Because we also know that early surge of blood pressure in early morning as the patient gets up is the major risk factor for a lot of strokes as well as heart attacks in the early morning periods.
Correct.
And nobody would actually check the blood pressure, or rather it's physically not possible to check the blood pressure or heart rate before getting up from sleep.
Correct.
This watch would help us in giving those parameters just before the waking up time. So that's why a continuous monitoring is definitely going to help us titrate the treatment dosages as well as the timing of the treatments. That would help in better monitoring as well as keeping these vital parameters in proper check. And as you said, the CGMS, the continuous glucose monitoring, gives us a second to second information about the glucose. Similarly, if we can have such second to second information of the heart rate as well, so this heart rate variability is going to be predicting a lot many of future cardiac events. Because in today's world, stress being a most important factor, how the stress is affecting the heart rate variability is something which needs to be looked at from a different perspective altogether. So stress management would ultimately affect the heart rate variability, and if that can be stabilized, which can be actually detected on this watch, then only we can say that a person is actually managing his lifestyle in a proper way.
Correct. Very rightly you mentioned and explained. One more aspect that I'd like to touch upon is CardiacSense does have capability of monitoring around close to 20 odd plus different kind of arrhythmias we are able to detect. One of the silent culprits in patients is also atrial fibrillation.
True.
Do you think that long avoidance or not understanding if somebody is having atrial fibrillation is one of the reasons why a lot of people suffer stroke?
Yes. Unfortunately, atrial fibrillation in today's area is diagnosed only after the patient is presenting with stroke or heart failure.
Yeah.
It is usually a subtle arrhythmias where the patients don't actually feel the palpitations so often, because it can be an intermittent episode, and the incidence of atrial fibrillation is rising day by day with increased longevity of our population, increase in the incidence of hypertension, as well as increase in the incidence of heart failure. And true. Atrial fibrillation, if not detected at an earlier stage, it is likely to cause structural damage to the heart in the form of enlargement of some chambers of the heart that can eventually become permanent. And once the atrial fibrillation becomes permanent, it is very difficult to correct the rhythm, even though the medications does help in controlling the rate of the arrhythmia. Yeah. But if it's too late, the rhythm is not going to revert back, and that induces the risk of blood clots within the heart, which can lead to strokes. So if atrial fibrillation can be diagnosed or documented at an earlier stage where it is still in a reversible condition, and if we can correct the rhythm of the atrial fibrillation, if diagnosed early, that would certainly prevent the number of strokes that we are seeing today.
So in easy to understand manner, what you're saying is that many times people who experience any kind of discomfort in the heart, that can be atrial fibrillation or any kind of arrhythmia. If any kind of discomfort or any kind of feeling is there, it's better that patients are able to go and get themselves checked.
The discomfort may not be only in the chest. It could be as simple as just lightheadedness or giddiness, which can be sometimes due to the heartbeat irregularities, and the patients are not that conversant enough to document the heartbeat irregularity. So any subtle symptoms which are new in onset, like lightheadedness, giddiness, any abnormal feeling of heartbeat within the chest, or sometimes it can be presenting as a heart failure complication as the first symptom, without knowing that the patient has already developed heart failure. So all these symptoms should suggest that a patient should visit their doctor, or at least get a basic ECG done, which can tell us if at all any heartbeat irregularity is there. But again, the resting ECG would only reflect that present moment's electrical activity. It can't say whatever has happened during the symptom which occurred probably few minutes ago or few days ago.
This is
So-
where CardiacSense,
Right.
medical devices like
Right. So we
CardiacSense
need
comes
to have
in.
a continuous monitoring device which
Correct.
can be worn on a day-to-day basis as easy as a watch, which can help understanding if at all any heartbeat abnormality had happened during those subtle symptoms.
As you were discussing about the arrhythmias, I think it's very apt to ask basically, you've experienced use of watch in some of the patients. Would you like to explain about your experience so far? Any arrhythmias that were reported by patients of yours?
Yeah, SVT or supraventricular tachycardia is a troublesome arrhythmia or heartbeat irregularities that is usually bothersome for most of the patients. And this is a arrhythmia which starts all of a sudden and goes off also all of a sudden, sometimes within few seconds or sometimes within few minutes. And this is not a daily process that applying a 24 hours Holter monitoring can pick up these arrhythmias. So whatever patients have applied the CardiacSense watches, I was able to detect these SVT type of arrhythmias which can be very well treated with radiofrequency ablation permanently or sometimes even with medications. But unless this arrhythmia is documented at that particular moment of symptoms, it's very difficult to pinpoint the reason for the palpitations and then treat them. So apart from SVT, I have also come across patients of silent atrial fibrillation, especially in those elderly hypertensive people who gets the silent atrial fibrillation episodes, and since they have been detected earlier, they were put on prophylactic medications so that their incidence of stroke could be prevented. And there are also a lot of benign ventricular ectopics or VPCs, what we call. Usually they are non-specific, but they can be related to as simple symptoms like hyperacidity or gas trouble, and whenever we treat these simple symptoms, these ectopics also go away. So the reason for the palpitations or uneasiness could range from very simple benign arrhythmias to bothersome arrhythmias like SVT, and sometimes long-standing implication type arrhythmias like atrial fibrillation. Of course, as of now, I haven't been able to predict VT or VF, but in high-risk patients such as heart failure patients, the earlier diagnosis of VT or VF would be definitely a boon so as to save their life or preventing a sudden cardiac arrest in these patients.
Absolutely. I'd like to ask one more aspect of the usage, since we are discussing the applications. How do you think the CardiacSense is useful in post-discharge monitoring patients who have gone through surgeries or who have gone through various kind of episodes, be it CABG or PCI, where stents have been planted, and also, in second part of the question, I'd like to ask you about application of watch in patients who are in heart failure.
Yeah. So usually immediately post-intervention like angioplasty or bypass surgery or wall replacement surgery, as long as the patient is in the hospital, there is continuous monitoring. But the patients are usually very much afraid that once they are discharged and reach home, how are they going to monitor? And it becomes a difficult scenario that even if they are monitoring with the available devices, they can monitor it max 3 or 4 times in a day. And every time any such abnormal reading is available, they need to inform it to the doctor, and it would be obviously a cumbersome process for the doctor to answer each and every message or phone call from these patients. So in such a scenario, we usually need monitoring of these patients for a period of 1 to 3 months depending upon their clinical status. And CardiacSense watch helps us in monitoring all the basic vital parameters, and any red flags, if at all are there, they are immediately notified to the patient as well as the doctor. But not every time it would be a red flag. Most of the times it would be subtle abnormalities which can be managed with just assurance, and for that this particular watch and the support team along with their most accurate diagnostic capabilities would assure the patients that there is nothing serious unless there is actually a red flag which needs to be reported to the doctor. Now coming back to heart failure, there is a major challenge in heart failure patients that most of the patients tend to come back for re-hospitalizations because of worsening of heart failure despite the optimal medical therapy. And the biggest challenge is earlier detection of worsening of this heart failure before the admission occurs. The patients reach to us only when they are into a very critical stage of breathlessness or swelling all over the body that needs hospitalization. So presently what we usually do is ask our patients to monitor their weight on a daily basis or monitor their vital parameters like heart rate and blood pressure. But the reason for heart failure recurrent hospitalization is fluid accumulation in the body, which happens even before the weight gain occurs. And this can be sensed through changes in the respiratory rate, especially while lying down at night. And CardiacSense watch is going to give us this particular variable at an earlier stage, which will detect these respiratory rate abnormalities at a much earlier stage, which will indicate accumulation of excess fluid within the body much before the weight gain. So it can actually predict heart failure related hospitalizations by at least 2 weeks before the actual index hospitalization is likely to happen. So that will give us a fair amount of time in adjusting the medications so as to prevent the recurrent hospitalizations.
As we widely seen, and you must be seeing on a regular basis as well, that heart failure patients, it's very challenging for them basically. Recurring hospitalizations, the costs attached with that, and also with every hospitalization there is quality of life reducing. You know, if at all there was a solution like it is being presented now by CardiacSense, do you think it can make a big difference if the symptoms before they show up, and we understand when the symptoms show up, it is quite late for patients and it's already hospitalization. Do you think early warnings basically like CardiacSense is saying this, that we'll be able to predict, will make a big difference in terms of their quality as well as longevity to a patient of the patient's life?
For most of the heart failure patients, it's a nightmare with every hospitalization. And the more frequent these patients get hospitalized, their lifespan actually goes on reducing. And every time, even after discharge, the patient is always in the fear that the moment their symptoms recur, they are going to go through the same phase of hospitalization with always the possibility of death during the index hospitalization. So if we can have a technology like CardiacSense which can predict even before the onset of symptoms of heart failure, whatever changes in the vital parameters are happening within the body, that will ensure that these patients can have appropriate change in the medications on a timely basis, which will not only prevent the onset of new symptoms, but also they will be relieved of the continuous anxiety and depression of recurrent hospitalization. That would significantly have an impact on their quality of life. They would be able to do their day-to-day activities in a stress-free situation, and the higher cost of recurrent hospitalization would be greatly saved. So it is going to cause an increase in longevity of the patient, reduce the fear of recurrent hospitalizations, and also save a lot of cost on these hospitalizations.
How do you foresee the application and usage of a technology like CardiacSense in your practice? As well as I'd like to ask if would you be recommending the usage of CardiacSense to your fellow practitioners?
Yes, I feel this is a one-stop wearable device which can guide us through all the basic vital parameters on a long-term duration for all those who are at risk of developing heart disease or who have already developed heart disease for their future monitoring. So it is definitely going to be a boon for majority of the patients, and I would definitely recommend my fellow colleagues as well to start using this device for their patients and that would definitely see a great future for most of the patients.
I'd like to ask, what advice would you like to give to common person basically who may be at a risk of any kind of cardiac disease in a way that in a preventive manner he is able to prevent himself from getting into zone where he can be called as suffering from a cardiac disease?
As we all know that prevention is better than cure, and for prevention lifestyle modification is the most important key. Although saying it is very simple, but getting motivated and continue to follow those lifestyle modification is the biggest challenge. And if we have digital technology who can push us to follow these lifestyle modifications, then definitely we should take help of that and keep ourselves motivated to follow these lifestyle modifications so as to prevent from future cardiac diseases.
Absolutely. I'd like to ask basically, what do you do in your free time in terms of your hobbies and your...
I love listening to music because that's the most easiest stress buster for me. And in fact, I would recommend everyone to have some kind of stress buster.
Absolutely.
Because nobody can prevent getting stress in their lives, but the key is to de-stress yourself from that stress, and de-stressing is definitely going to help in maintaining a healthy body-mind balance, I would say.
Anything on a dietary side basically that you recommend on the physical activity side?
Diet is a very subjective matter because nobody can have a generalized dictum for following a specific diet.
Yeah.
It is likely to vary across the culture and custom, especially in our country like India,
Yeah.
where there are various customs regarding diet is there. So I would suggest, in fact, you should rely on a specific nutritionist who can understand your dietary profile, your lifestyle, and then recommend you a suitable tailor-made diet that would be most appropriate. As far as physical activity is concerned, again it would be please follow some amount of physical activity, as we all say that something is better than nothing, and this some amount of physical activity should gradually increase to a moderate level so as to keep your aerobic as well as your endurance levels to the optimized levels.
Very rightly said, starting small and setting small achievable goals basically can go a long way in getting one started and ensuring that we gain. Body is designed in such a way that more you use, better it becomes.
True.
So, thank you so much, Doctor, for coming here today and helping us with all the knowledge that you have shared. Thank you.
Thank you.
Thank you.